Go ahead, Claire.
Thank you, Elizabeth, and welcome everybody. Welcome to another week of the CNA's Canadian Nurses Association webinar series, Coffee with Claire. And for those of you who are new this week, this is our seventh webinar, seventh session, our conversation, Coffee with Claire. My name is Claire Betker, and I'm the president of the Canadian Nurses Association until the end of June. So I'm coming down to the final few weeks, and then Tim Guest, who I think is online, president-elect, will take the reins. And he's from Nova Scotia, and he's going to do just an outstanding job as the president as I transition to other things. But I'm a long-standing registered nurse from Manitoba. I'm here in my home in Winnipeg, Manitoba, where I have the privilege of working virtually right now as the scientific director for the National Collaborating Center for Determinants of Health. I'd like to begin by acknowledging that the land that I'm on right now is Treaty 1 territory, the traditional territory of the Anishinaabe, the Cree, the Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. So the genesis of this series of conversations with Claire was to give us, the officers and the board of directors and the staff of the Canadian Nurses Association, an opportunity to engage with and to have conversations with our members and with those that are our team members and our collaborators and partners. And it's been a tremendous success. We've had a lot of interest and a lot of engagement and very good attendance. So today we are going to talk about a very, very important aspect of the COVID-19 pandemic. And that is the significant impact that COVID-19 has had on the long-term care sector in Canada. And I'm joined today by three guests, three experts. We had an absolutely outstanding pre-meeting to this conversation. So I'm really, really looking forward to our engagement with them and to our conversation. So I'm going to start by asking each one of them to introduce themselves. And so we have Carole Estabrooks, who is a professor and a Tier 1 Canada Research Chair in Knowledge Translation at the University of Alberta. So I'm going to ask each of the guests to give a brief introduction to themselves. So over to you, Carole.
Great. So I'm also the scientific director for the Translating Research in Elder Care program, which is an applied program we've been running for 15 years in residential long-term care, also known as care homes or nursing homes. So the part that's at the very end of the line. And those are my credentials in terms of being here. Back over to you, Claire.
Okay, so Carole, we kind of missed the very beginning of it. So you're in Edmonton, Alberta, and you're a registered nurse?
Yes, I'm a registered nurse. I've been a registered nurse for longer than I'll declare, and have been a researcher for 25 years, and the last 15 in long-term care.
Thanks, Carole. Thanks so much for joining us today and for finding the time in your busy schedule. So next, I'd like to introduce Jennifer Calver, who is the Professional Advocacy Director for the Gerontological Nursing Association in Ontario, and much more. So Jennifer, I'm going to get you to give just a brief introduction for our audience today.
Thank you, Claire. I do want to begin by extending a huge thank you to all of the nurses and allies who really have come together during these challenging times to go above and beyond to support this population who are living with chronic and advanced chronic care needs. So as Claire mentioned, my name is Jen Calver. I am a registered practical nurse in Ontario with a certification in gerontological nursing. I have my Bachelor's of Allied Health Science honors degree from Ontario Tech University. During this cross-disciplinary and research-intensive pathway program for healthcare professionals, I really concentrated on looking at the Canadian healthcare system, looking at around intra and interprofessional team performance and areas of advanced adult education. I'm currently working on my master's thesis, looking at policy implementation science in the area of nurses' experience with chronic healthcare needs within today's healthcare system. My background primarily lies in the long-term care sector as both a regulated and unregulated capacities. I began my career as a personal support worker before I became a nurse. I'm very passionate and dedicated to supporting populations with chronic healthcare needs and the teams who participate in their care. I've worked on some quality improvement projects and programs around fall intervention and prevention, skin and wound care, dementia strategies, and many other projects around looking at the chronic healthcare needs of the population. Additionally, I'm involved in several nursing organizations, and I've been recently elected as a professional advocacy director for the Gerontological Nursing Association, Ontario, as Claire mentioned. This is a special interest group of WeRPN, and which is a Registered Practical Nursing Association of Ontario, and the RNAO, which is a Registered Nursing Association of Ontario. So again, primarily my background is in working in the long-term care home environments, but I also have clinical experience in hospital, community care settings, teaching environments, retirement settings. I think that's, I'll turn it back over to Claire.
Thank you, Jen. And I don't know you well, but it appears to me you've got some years in front of you. So well done. That's an extensive list of accomplishments already, and in a very, very important sector of our health system, as we know. So Miranda Ferrier is the president of the Canadian Support Workers Association and Ontario Personal Support Workers Association. So both of those. So Miranda, could you give us a bit of information about you? Miranda.
Absolutely. Thank you, Claire. Miranda Ferrier. I am a personal support worker of 14 years. I worked in long-term care and home care and hospital settings as a personal support worker. My most current role is the president of the Canadian Support Workers Association and the Ontario Personal Support Workers Association. We currently represent across our nation over 58,000 support workers and 41,000 here in Ontario, where I am located. So it's an absolute honor and privilege to be here today. Thank you, Claire.
Thank you so much, Miranda. And again, thank you for the three experts and guests that have very generously shared their time with us here today. So I'm going to begin by briefly touching upon some of the advocacy work that the Canadian Nurses Association is doing relative to the COVID outbreak or the pandemic, especially in terms of the long-term care sector. And then I'm going to pose a question, and these questions came from the chat box and from the Q&A box. And if you hover your mouse, you'll see at the bottom there that you can actually type into the chat box and introduce yourselves, where you're from. You'll also see some resources that our guests have provided to us and that CNA has. So you'll see those start to come up in that chat box. There's also a place down there called Q&A. If you have a question, we hope to have, it's a 45-minute conversation. We hope to have time for at least one or two questions from you, our participants. And right now, if I look, there's 147 participants right now. So this is an area of great interest to you and concern. And you can provide comments, you can share your own resources, you can pose other questions as you go along. And we at the Canadian Nurses Association commit to either answering those questions to the best of our ability or finding the expertise out there to answer those questions. So use the chat box, please, to introduce yourself, and the Q&A box to pose your questions. So this discussion will be in English. However, we are joined by Josette Roussel, the Executive Advisor at the Canadian Nurses Association, who will be able to answer questions in French. And I'm just going to ask Josette to say a few words right now. Thanks. Josette?
Merci Claire. Bonjour à tous les participants. Alors, on vous invite à demander vos questions en français si vous le désirez dans la boîte Q et A en bas de votre écran. Et nous répondrons aux questions dans la langue de votre choix. Alors, nous vous remercions de la participation des gens aujourd'hui et je laisse la parole à la présidente, Madame Betker. Over to you, Claire.
Thank you. So please feel free to ask your question in French or to ask for a response in French, and we'll do our best there. So I'm going to ask Elizabeth to put up a polling question. It's another way for us to sort of engage with you and get your opinions. So she'll put that up. But I'm going to just keep going here. You can see that polling question and we'll give you the feedback in a minute. So the COVID-19 pandemic, as it was declared on March the 11th, has exposed long-standing vulnerabilities in the long-term care sector in Canada. And tragically, by the end of April, Canada had nearly 3,000 COVID deaths and a shocking 79% of which, according to the Public Health Agency, were related to outbreaks in long-term care. And as of Wednesday, we found out that that number is actually higher. In fact, it's 82%. So it is trending up. People requiring long-term care have greater and more complex care requirements than ever before. And I spent about 10 years of my career in the home care sector. And that's a number of decades ago. And it was trending in terms of complexity at that point in time. However, long-term care facilities often have fewer regulated nurses, fewer staff, fewer clinical educators, fewer recreational therapists and aides, fewer social workers and social service support, physio and occupational therapy therapists, but they also often have less access to specialists. And in terms of one of them that's very important right now would be the infection prevention and control specialty. And this has had dramatic impact on the unregulated workforce, which is responsible for, and we're so pleased to have Miranda here, for 80 to 90% of all point of care. So changes to staffing mix and inadequate staffing levels have created really an unsustainable workload for long-term care providers and thus impacted on the safety of the people who rely on that sector for support and for care. So effective immediately, the care needs of older adults really require changes to the health system. And CNA is advocating for a review and reform, however that might take, whatever form that might take, of the long-term care sector, because really it is responsible in providing care for some of the most vulnerable people and populations within our society. And we've developed a document that's online, and I think Elizabeth is going to put it up right now, called CNA's Key Messages on COVID-19 and the Long-Term Care Sector. So we encourage you, the link will be posted in the chat box by Carrie, and it's available on our website. And any feedback on it is welcome. Please let us know what you think about it. But it looks like a really good resource for us. Okay, but I'm really excited to get to our guests and our conversation with our guests. And so I'm going to ask them each a question. And I'm going to start with you, Carole, up there in Edmonton. So at that system level, and as you said in your introduction, you've got a long time both in the sector, but also from a research perspective in this sector. What do you think are the top 2 to 3 issues and opportunities that you see in the long-term care sector right now, right in May of 2020?
So I missed part of your question, Claire, but I think I know what it is. What I wanted to articulate in response is 3 things. We've got a fire in our house, and it's not the house, it's our house. And we've got to get it under control. And we're going to have to, we've been doing some things that we can't continue forever. Like we can't keep, the army isn't a solution. It's an emergency stopgap. So as soon as we can, we've got to get that fire under control. It's absolutely correct that there's a light being shown on long-term care that's showing in stark naked reality the long-standing faults and breakages in that system. I've been saying over the last 3 weeks, you know, we've held that system together with a combination of care and goodwill and duct tape, and it's broken open. But we also have a super highly vulnerable group of older adults there. They're old with chronic diseases and dementia, and they have really compromised immune systems. So we could have predicted that that would be the group hardest hit in the pandemic. And even when we did, we weren't equipped to deal with it. And I won't enumerate all the issues that we have to sort out immediately for the current crisis and the waves that will follow in terms of PPE and all those sorts of immediate emergency things. So right now we've got to get it under control. We've got to increase our preparedness. We've got to stabilize everything that we can. And we have to very quickly get the right voices at solution tables, and we have to have data to inform decisions. A lot of decisions are being made now without data, and it's not that people want to do that, but we're shooting in the dark, and we have some big gaps in the country, and we've got to fill those and use some of the ones that we are having. Beyond the fire, we have to look really quickly at fundamental redesign in the system. First of all, how should long-term care be managed in Canada, and what is long-term care? It's clearly integrated with everything from home and community through to acute care, and there's home care and assisted and supportive living and retirement homes. I'm talking primarily about what people usually call complex continuing care or nursing homes or residential long-term care. But how should it be managed? It's not part of the Canada Health Act. Should we have a separate long-term care act that provides some national standards and regulation and gives people the same rights under that act as we have under the Canada Health Act? It's not a health system entirely, it's a health and social system. So, and that isn't well known in all quarters, because it's not just about medical problems, and anybody who's worked there, including the people on the panel and the audience, know that it's about much more. So as we're redesigning, I think we have to focus on quality of care, absolutely, quality of life, and we're not doing a very good job of that in the country. We're not even measuring it. And quality of work life. And that brings in the important things that we have to do around our workforce. It's primarily in the immediate sense, the 80 or 90% of the care that's provided by personal support workers or care aides that is clearly in disarray because of our lack of preparedness. But it's also the supports that they need around them in terms of regulated nursing and allied professions like physio and rec therapy, as you've mentioned. And all the other kinds of supports we need. So the workforce isn't just paid workers, and it's not just paid nursing and allied workers. It's we have paid companions in some homes if you can afford it. Well, how does that fit into the equation? We have huge groups of unpaid workers, families, primarily women, but not exclusively, friend and companion caregivers, volunteers. There's a whole raft of things we have to look at when we have to have those supports in place, and we have to have a sense of integration so that we can do the things that bring old people in nursing homes, not just safety in terms of not having pressure ulcers and pain, but bring them quality of life. So we all would be in despair if we woke up every morning and there was no sense, purpose, or meaning in what we do. And it was a chaotic kind of anxious nothingness. And the older adults in long-term care don't have to wake up that way. It's absolutely possible to have quality of life if you've got moderate to advanced dementia, but it takes effort, and it takes the right combination of people's and we need to think about not just things like some of the models have in terms of surroundings. That's really critical. I mean, it might be good if we stop 4-bed units. That's clearly an infection issue. And we have to re-engineer some of our current builds as much as we can, and then build out appropriately to meet the increasing demands there are. So, but it's not just surroundings, and it's not just a good aesthetic, which is critical. It's getting outdoors, it's having connection with animals, it's having connection with other beings, it's intergenerational living. So there's just a huge amount of redesign that we have to undertake, and it only can happen properly if we put the right voices at the table. That means people with dementia who are going to need long-term care, and families and frontline workers like PSWs and others, as well as policymakers and funders, and because it's not any one thing. There's not one fix to this. And then the third thing I would say we need to focus on, and this is a harder one, is the value Canada as a country places on caregiving. And who does caregiving? Whether it's caregiving for children or older adults, I would argue it's not well valued and not always properly remunerated. I believe, and I think people who really care about this part of the system and the older adults there believe that this is honorable work and it shouldn't be dismissed or not remunerated or not valued or seen as disposable. We don't even count personal support workers properly in this country, and they're not regulated. So there are a lot of core issues that go along with the value of that we place as a country on caregiving. And you can't do that. And we will be forced to look at the fact that women are the primary caregivers. They're 90% more or less of the paid workforce. They're 75 to 80% of the unpaid workforce. When a woman leaves her job because she wants to help her mother in a nursing home or elsewhere, it's usually the woman in a marriage that does, because her work is usually valued less. And so it makes more practical sense for the husband to continue working if it's a traditional arrangement. So, but it's not just money. It's recognizing in all those ways, and this goes for nursing as well, that this is essential work to our country and work that must be done if old people are going to be placed in the value equation where they should be, and not seen as people we can put away and hide, and because they haven't got a voice, not advocate for it really strenuously. So that's a big agenda. It won't happen overnight, but there's an enormous amount of goodwill in the country right now. The people on this panel are exemplars of advocates, and I recognize some of those names in the participant box, and I know many of you are strong advocates. So it's everybody from researchers to families to clinicians to politicians. Thank you.
Thank you, Carole. That was a great answer to that really big question. And people are asking in the chat box if this is being recorded, and yes, it is, and it'll be available on CNA's YouTube channel. So just sit back and enjoy the conversation. And if you want to go back and find out what people have said and take notes, you could do that later. I love your word agenda. I think it is an agenda. And I think you gave us a great beginning to our conversation. What I hear is really having the opportunity and actually the right to a dignified life, and all of the aspects that go into that. And you really challenged us to think about the values, not only within our profession or within that sector of the health system, but as a society. And what I heard is that we really need an equitable and a just system. And so that was a beautiful summary and a great agenda to challenge us with. So Jennifer, I'm going to go to you now. And Jennifer, given the hard lessons that we're learning in the current COVID-19 situation, the pandemic, how, from your perspective, do you think we sort of shift that language, shift that thinking, maybe even shift those values, as Carole talked about, to build a system of support, or that culture of support for the long-term care sector? So over to you, Jennifer.
Thank you. Reflecting a little bit on what Carole said, the point that the long-term care sector is such a wide continuum. It really does bring together health and social systems into an integrated care model. And as we draw attention to the challenges and issues in this sector, and I'm speaking from long-term care homes, and I'm speaking of community care and hospice care and it's such a wide berth of services, which does encompass paid workers and unpaid workers. We really draw on our community for supports and depend on families, and it's such an important part of our community. I think we need to be very careful as we look at this attention, and to really be cognizant of the languages that we are using around these areas as we do move to alleviate some of these challenges and come up with innovative solutions. The last thing we want to do is to foster a culture of blame, which evokes fear and apprehension within this sector. We want to avoid creating stigma and discrimination of this specialized sector. The majority of long-term care right now is looking at our older adult populations who are living with multiple chronic health complexities. And these include functional limitations, cognitive limitations, but there's also a small subpopulation of younger adults that are included in this model as well. I'm seeing such remarkable work all over the country as nurses and support staff are really going above and beyond the passion and the dedication that they are showing to provide care and support for this population, to ward off feelings of loneliness and hopelessness as residents are restricted, visitors are restricted into coming into long-term care homes. Loneliness and hopelessness are often feelings expressed by older adults, even in communities. And healthcare workers right now, nurses included, are filling this void. So as we engage in discussion and we look at forward-thinking solutions and really prepare for the recovery stage of COVID, we really need to be ensuring that we're creating an inclusive environment. We're helping to support each other's specializations and practice efforts. I've spoken with different nurses from all across Ontario and across Canada who are absolutely making remarkable contributions during these challenging times.
Thank you, Jennifer. Thank you. Thank you so much for that. And I really appreciated the perspective where long-term care is part of the community and that you rely on the community and there is that reciprocity with communities and engagement with communities. I really appreciated that. But and your notions of changing our language and avoiding a culture of blame and looking for that solution oriented. And someone in the chat box talked about evidence informed too, that all ways of knowing and all of perspectives as we move ahead. Okay, so Miranda, with the current situation we're dealing with due to COVID-19, from your perspective as a personal support worker, but also in terms of your national and provincial perspectives, what are the top 2 to 3 issues from your perspective? And what are some of the solutions that you've seen from a personal support worker perspective? Over to you, Miranda.
Thanks very much, Claire. You know, when we had our meeting earlier this week, I actually brought the questions to our membership, to a smaller base of our membership of about 10,000 personal support workers and continuing care assistants and healthcare aides and PCAs, and the list goes on and on, about what are the top issues across our nation in regards to long-term care and COVID-19. And I was not surprised by the answers. It's interesting, so let's get down to it. So the first one obviously is not enough staff, AKA support workers on the front line. This was an issue prior to the pandemic. I think we can all agree on that. And now what we're seeing is staff is getting sick. You know, they have to go home and self-isolate. Then who do they put in place? So here in Ontario, we actually have a very, very wonderful relationship with the Ministry of Long-Term Care. And they actually they had an emergency order to lift training requirements for hiring in long-term care facilities, which we reluctantly agreed to. And the sad thing is that still did not bring enough people into long-term care in order to care for our loved ones in long-term care facilities. What we think from an association standpoint, from what we're hearing from the support workers, is, you know, more full-time positions in long-term care. You know, this is all past pandemic, but PSWs were part-time casual. When I worked in long-term care, and I did for 8 years, it was always a part-time casual position. You were lucky if you got a line in long-term care. You have to work there for 20 to 30 years before you get full-time benefits on the day shift. And it's just, I laugh, but that's the honest to God truth. So that was the first issue that's really been a huge component with the COVID-19. The second one, and I'm just going to hit on two of them here. The second one is undue burden of responsibility without any formal recognition. So this is playing right into what Carole was talking about, even a little bit with Jennifer, where personal support workers or support workers, wherever you want to call us across this nation, we are unregulated, yet we do the most intimate of care for society's most vulnerable. Gives you pause, right? And you know, we were never essential. We were never deemed essential before the COVID-19. And suddenly here is this profession that is suddenly deemed, you know, essential and is being told to go into homes and put your life at risk, but we're not going to give you that recognition that you deserve. We're not going to give you the accolades that you deserve. So how do we fix it? And let me make one more point before I say that. As of this morning here in the province of Ontario, we have lost 5 personal support workers to the COVID-19. And I'm going to give pause on that for a second, because that's our reality right now at the association and in this province. It's a scary time here. But how do we fix this undue burden of responsibility? And might I add, they are still stepping up to the plate and going to work and being on the front lines with our most vulnerable through this. We need to self-regulate the personal support workers. We need to have a body that oversees, that supports. We need a solid base to grow from in order to grow this profession into a profession of choice, as opposed to just a fly-by-night, I'm going to become a personal support worker. Just, you know, I don't know who would do that, but some people do. And you know, we were really honored. We have actually the association here in Ontario, we represent 41,000 PSWs, and we have been successful at getting a proposal for self-regulation in front of the Ontario government. Now, mind you, it's been many different proposals over the course of the last 5 years, but we were actually able to get the proposal in front of the Premier recently for self-regulation. Our model here in Ontario is a no-cost option. So it's kind of a win-win. And to be perfectly honest, if we want to see PSWs stay in long-term care, if we want to have, you know, quality of care, continuity of care in our long-term care sector, then we need to recognize the people that are doing the job on the front line. And that would be self-regulation. I just want to give a shout out to the CNA, because in last year's budget submission to the Ontario government, they endorsed us for self-regulation here in the province of Ontario. So thank you very much for that, Claire. I really appreciate that.
Okay, thank you, Miranda, for some very strong statements, some very strong issues, and some very strong solutions for that. Thank you so much for that. So we're going to go to the audience now. So Elizabeth, I'm going to ask Elizabeth Morin, our expert within the Canadian Nurses Association, for Zoom and for Zoom technology. And without Elizabeth, these conversations with Claire just wouldn't be possible. So Elizabeth, if you can put up that polling question right now. I'm going to turn it also over to Carrie Shoehandler. There's been a number of questions come in through the Q&A, and there's been a number of comments coming in through the chat box. So Carrie, do you have a question that we would pose to our guests, and then we'll take an opportunity to answer that, and then we'll go to some closing comments. We have about 10 minutes left here. So Carrie, over to you.
Great, thanks, Claire. So I was struck by a question about what can we do to entice nursing students, or not just nursing students, but students of all health disciplines into long-term care, and what can we do to support them with placements in that capacity, and what type of advocacy needs to be done to make that happen? If each of you could comment, if there's time, that would be great.
Okay, and I'm going to go in the reverse order. So Miranda, I'm going to ask you first, then Jennifer, and then Carole, I'm going to finish that answering to you. So Miranda?
We cut out a little bit there, Carrie. I didn't catch the entire message or the question. So do you mind repeating that again? I apologize.
Not at all. Just what can be done? What are your thoughts on how to help PNs, RNs, healthcare aides, and PSWs to preceptor and support students? How can we draw students in for placements into the long-term care sector and give them the support that they need so that they can be enticed into seeing the value of long-term care and remaining in the sector?
That's actually a great question. We work with all the community colleges here in the province of Ontario, and I know they have a great system here where, and I can speak to my personal experience when I did my long-term care placement, is you're teamed up with a personal support worker in the home. You go with that personal support worker, you work with them. You know, I think it's about, we have to change how people relate to each other in long-term care facilities. There's a lot of stigma on the long-term care sector where it's like, oh, if you work in long-term care, then you are going to be bullied. I mean, bullying is an issue in long-term care. So I think I'm going to go back to Jennifer's point about changing the whole culture within long-term care. That's about the only way that we're going to be able to keep these people in the sector. I hope that helps.
That's great, Miranda. And it's interesting that this question came in through the Q&A, because this was a question that we actually, as a group, when we were doing our planning meeting, talked actually quite extensively about, even in terms of our own commitment to nursing or to being a personal support worker, and kind of our own draw into it and what the future looks like. So Jennifer, what's your thoughts about students and education and preceptorship and drawing people into long-term care as a career choice?
I'm very pleased this question came forward because it's very important. Long-term care itself is multifaceted. Long-term care, as I mentioned earlier, it does involve community, it involves retirement living, it involves hospice care. It's such a broad spectrum of services that we offer. If I'm going to look at long-term care homes, especially right now, as Claire mentioned earlier, are experiencing the highest number of COVID-related deaths during these times. We want nurses in long-term care, they're charged with the responsibility to perform multi-system assessments for various health complexities, and the acuity and complexity of these conditions are actually increasing as the change in the population healthcare needs kind of move over time and shift over time. We are seeing more acuity within this sector. Our PSWs and I believe care aides in other provinces, they're the front line. Some nurses say that they're the eyes and ears of nurses, but long-term care and with these changes, I feel they really need to increase the number of registered practical nurses, licensed practical nurses, and registered nurses, and in those direct care positions, because together, when you're looking at resident assessments and you're looking at developing individualized care plans and implementing these programs and doing continuous evaluation, it's not necessarily realistic for a nurse to have sometimes 100 to 200 residents care to oversee, and then as well as leading and supporting a team. And for the same for registered and licensed practical nurses, when you're overseeing such a large number and you're working to support PSWs in their role the best you can, and you're doing these high-level assessments on each resident, whether you're caring for 20 or caring for 100, you definitely need to attract these skilled workers. You definitely need people who specialize in this area. And for students coming in, they're going to be working with nurses who do have specialized training, whether it's in advanced foot care or a certain system, or their background is in emergency medicine or palliative care. I mean, gerontology and looking at long-term care needs, it's such a comprehensive system. So that is what draws students in, from what I hear from the students I've engaged with. But nurses need supports to be able to spend the time to train them accordingly so that they can develop these specialized skills and feel supported, and we retain PSWs and nurses in these settings.
Thank you, Jennifer, for that very thoughtful answer. And it made me reflect on my time in home care, where you know, we were in some of the most intimate moments in families' lives, and rarely had students who wanted to do their practicums with us. Yet it was really, really high-skilled nursing, but it was also a real team effort in terms of maintaining and promoting the independence of families. And this was in rural Manitoba. So Carole, this is your kind of wheelhouse. You've been an educator and a researcher for many, many years. So what are your thoughts in terms of the answer to that question around long-term care and students and student education?
So I'm going to speak primarily to regulated nurses, registered nurses, but some of this applies all the way through the workforce. And I'm going to have to declare that I'm speaking only about my perspective after 40 years in nursing, and not on behalf of anybody. But this has been the bane of my existence. So the first thing I would do is I would immediately eliminate the practice of sending first-year students into long-term care so they can learn bed baths. I think that's outrageous. It is the most complex place that older adults are, and we shouldn't foist first-year students on long-term care to learn basic things. I think we should be putting our more senior clinicians in long-term care as undergraduates. I also think they should be supervised by competent instructors from the educational institution. How are we going to get research to the bedside if we make it 18 times removed from the frontline staff? So that's some of the first things I would do. I think we've got a serious attitude adjustment. Now, there are some really terrific places. Don't get me wrong. I'm making broad sweeping generalizations, but I see this current. I've been told as a researcher by other researchers, well, why would you want to do research in long-term care? They will all die pretty soon anyway. I've been told that. I've had students who wish to work with me told, why would you want to go work with Estabrooks? She studies the personal support workers on the front line. Do you want to be known for that? So there are some inherent biases and prejudices that we must eliminate. If nursing was going to step up to the plate, we'd look at the demography of the country and we'd hang out a shingle in every prominent school in the country and say, we offer some of Canada's best geriatric and gerontological nursing training, and we have an active research program, and we have placements, and we have preceptorships, and we have paid internships, and whatever it is we put together. So I think nursing has a huge space that we could step into and advocate on all aspects. Practice, the curriculum in nursing educational institutions needs to have the care of older adults and the health promotion, health, disease prevention, health promotion everywhere. You know, I talk to too many young high school students who say, I say, why do you want to go into nursing? And I would say 80% of them have a really distorted perspective of what it's like. Unless you're in pediatrics or labor and delivery, you're going to be a geriatric nurse, whether you like it or not. And it's good work. It's so complex. We're in a similar position to geriatricians, but you know, that's their wheelhouse. They'll have to serve their problems, but they often face the same prejudices and biases, even though their medical care is far more complex than an anesthesiologist, I would argue, or a dermatologist or whatever. So I think we've got to step up and have a voice, really re-examine our curriculum, really re-examine our attitudes, and start saying with pride, we are responding to the public health needs of this country and the care needs of this country. And this many people in the country are getting old and getting older and have dementia. And so let's step up and do that. Let's put nurse practitioners where we need them and CNSs where we need them. And let's help nurses with leadership roles. Let's help nurses get rid of what Miranda and Jennifer have alluded to, which is this parallel play in nursing homes. So the PSWs do their work and the RNs and others do their work, and never the twain shall meet. We've got to open up the gates. Sienna Casper and Lethbridge and others, and James in Ontario have written about this. The gates are too often closed, so we need to open them up, because the residents don't get the best care unless the PSWs and the nurses, and it's usually LPNs and RNs, are communicating back and forth and respecting each other. I mean, you can't, if you got one nurse on the floor for 40 residents, you don't know what's going on unless the PSWs are right on their toes all the time. So we've got to open that up, and we've got to acknowledge that frontline workers absolutely make assessments, and it's naive of us to think they don't, and to help them and support them in decision making and all the other things that go with it. So you've hit a sore spot of mine, because I've been distressed for years at the lack of prominence. Like all the action in nursing isn't in ICU and emerge. And I'm an old ICU nurse, so I know how exciting it can be. And I know how tough it can be. And I want a good ICU too if I have a motor vehicle accident, but it's not the only thing we do. And it shouldn't necessarily be the majority thing when you look at the population, both globally and in Canada. So I think we need to get onto that agenda, and I think CNA can and should provide really robust leadership in that regard, as well as provincial associations and colleges.
Thank you so much, Carole. So people are typing in the chat box where our 45 minutes is up, and I'm just going to take the 1 second here. So please put your ideas. Carole just ended there with that CNA can take a leadership role. I see there's some of our board members are online today and participating in the conversation, but please put into your chat box right now some of those ways that I love. I started when Carole talked about an agenda. So how can we start to just really move solidly on that agenda right now? And I'm going to give each of our guests, first of all, again, thank you so much for the range, but also the depth of your answers to what were not easy questions. So I'm going to go, first of all, to Miranda. Just what's a closing thought as we close our conversation here today? And then, Carole, I'm going to come back to you. And Jennifer, I'm going to give you that last word, okay? So Miranda, what's your closing thought here today, this afternoon?
Thanks, Claire. You know, it's so awesome to be a part of this panel and to hear that people really do see the issues on the front line for PSWs. You know, I think my final thought at the end of all of this is, in order to fix the system, we need to work together. And we need to be that interdisciplinary healthcare team that everyone has envisioned in our dreams. I'm game So Claire, let me know if there's anything we can do to help.
Right on, Miranda, and right, we are stronger together. I've been saying that for 4 years now, and we're in this together. So, and Carole said, this is our space, our collective space. Let's step into it. Carole, any final thought?
I just wanted to conclude with, despite this really tragic situation that's rolling out across the world, and the grief and the suffering that's part of it, if out of it can come a silver lining of shining some attention and creating a call to action that reverberates across the country, not just while the media is interested, but for the foreseeable future, that brings me hope in the middle of all this. Miranda's absolutely right, as are you. We need to work together and set aside our differences and really remember what the goal is. People should live the last phase of their life with dignity and pleasure, and they should die a good death. And we all want that for ourselves and for our families and for others. And I think we can achieve it. It's a big, hard road, but I think we can do this if we really mobilize and work together.
Thank you, Carole. And you know, it's that call to action is there, and it's really about how we're going to answer that call, right? It's there. That call is there. It's very obvious. So how we together answer that call. So Jennifer, final word to you, some closing thoughts.
No, we've mentioned it many times during this session about shifting our language. Nothing saddens me more than what Carole was mentioning there earlier. When nurses look at moving into the long-term care sector, considering it as a career choice, it really saddens me to hear other nurses and healthcare professionals say that you're going to lose your skills moving into the long-term care sector. Nurses and personal support workers, care aides, they're choosing to be here. Your regulated nurses, your registered practical nurses, licensed practical nurses, your registered nurses who work in this sector, your care aides, many of them right now in the face of COVID are not seeing their own families because they're dedicated to serving this population, to supporting these complexity of care needs. And this is not an invaluable scope of skills. Nurses have opportunities here to really step up and care for populations with chronic and advanced care needs. And that requires us to all work together. So in closing thoughts, and as we move forward and this really sad situation has occurred in the long-term care sector in the face of COVID, we really need to stand together as we move forward, because this is a very skilled discipline. This is a very valuable work. And
thank you. Thanks, Jennifer, so much. And just the word that came into mind for me there is standing in solidarity with each other. But I'm going to go back to something that you said earlier, and that's also standing in solidarity with the people and our communities, of which we are all members and are all part of. So thank you for that, and being united in our answering that call and advancing that agenda that Carole so ably laid out for us 45 minutes ago. So thank you so much to the three of you for bringing both yourselves, but also all of that knowledge and expertise and those deep felt thoughts, those feelings that you brought here today. So next week is National Nursing Week, and the theme of it is Nurses, a Voice to Lead. And I'm going to get tingles here. It's actually Nursing the World to Health. So that theme is very, very relevant to what we had the conversation about today. So we are actually changing the conversation with Claire Day next week to Tuesday, which is May the 12th. And it is the 200th anniversary of Florence Nightingale's birth. She was born in 1820, and it's on May the 12th in Florence, Italy. So please join me and us next week. We are going to be joined by the president of the Canadian Association of Midwives, as well as other guests from other regulated categories of nurses, to share our perspectives or their perspectives on where we are and where we can go, and what I think will build on the conversation that we had today, maybe in a more general perspective. So I really hope that you can all tune in at 12 noon Eastern time on May the 12th, and I really hope to see you then. Thank you to everybody who came today. We had more than, I think, 160 people that attended, and more than 200 that actually registered. So thanks for joining us, and we'll see you next week. Bye now. Bye, everybody. Thank you.